Look at TMJ. How many of you have a TMJ? Every one of us have TMJ. TMJ dysfunction is actually when you have the cracking or popping. So all of us have a temporomandibular joint. That's what TMJ is, okay?
Does that also refer to when the jaw locks?
Locked jaw. Repeat. Yeah, that's temporomandibular joint dysfunction. Okay? So that can be, a dysfunction means that this joint just isn't working correctly. So a temporomandibular joint dysfunction really can be anything from the disc in that joint is starting to lock, or it allows then you to open to a certain point, and then the jaw slips over that into an inappropriate position and the mouth stays open. After a long dental procedure, 2 hours plus, can lead to the TMJ dysfunction.
10.
10, 8, new record, 12, right? Yeah. What did you say? Only you could understand that, right? Go
I
ahead.
had my tonsils out, and that's what gave me the dysfunction.
Correct. Now here's something that I want to actually show all of you this evening. Whenever you've had your mouth splinted open or held open for a long period of time, okay, you actually need to reprogram or reset your jaw. There is, your brain has, and this is going to be a big side note for you, but let's actually just back up just a bit. So we're going to take away those tonsils. They aren't that swollen today. And inside is this jawbone, and inside this is where all the teeth go down into, and then the jawbone comes up like this and articulates with this cartilage of the temporal bone. And the temporal bone forms this area, articulates with the occipital bone, the sphenoid bone. That's just information. But this is the key, okay? When this is open, this is a free hanging sling. And as you look at this free hanging sling, okay, it's not gravitationally loaded like our other joints are. My knee, when I'm standing upright, is gravitationally loaded, right? It's weight bearing. But this has nothing underneath it to hold or resist when we're upright. So when we hold the mouth open for an extended period of time, those muscles actually are not accustomed to forcing open, right? We actually are accustomed to occluding or closing strongly. So when they stay open for a long time, it's just like taking your hand and holding it stretched at a maximum for an hour and a half, 2 hours, 3 hours, 4 hours. What's going to happen to those muscles? They start to fire differently, so when you come up and try to close, now the mouth doesn't feel appropriate. So one of the best things we can do is reprogram the jaw quickly. We slide with the mouth closed, we slide the jaw forward, then open, and then let the teeth come back together. Okay, so this is what it looks like. Slide, open, and then occlude. Okay, so as soon as you've come up, and especially if we're trying to reset or find the bite again in occlusion, I had this crown put on, and ever since I had that crown put on, my mouth has never felt the same. I've gone in and they've drilled off that crown, we've drilled the tooth above, now it's off on this side, now it's off on this side, and all of a sudden from one crown we've drilled at every single tooth in my mouth, and I'm so mad I'm never going back to that dentist again. Right? But what happens is, what happens is, when that mouth has been open, there becomes some swelling potentially in this joint, and then also these muscles lose their appropriate positioning, and so consequently, if you'll just 4 times, thrust, open, and then contact, okay? Reprogram your jaw after it has been open, and you'll actually find then that it will find home again very quickly. Sit up, especially if you've had a long procedure. Don't just stay down in the chair and do the little blue strip. Say, do you mind? Can we do that with me weight bearing? Because you want all of your joints are supposed to be loaded gravitationally, and then this free hanging sling, instead of being back where I've been for 2 hours, when I come back up, I'm going to reprogram it.
Why don't they just do that anyway? I've wondered that so many times, because your jaw falls back when you're
Because it
laying
takes
down.
time. That's the biggest thing, right?
You
I mean, if you have somebody up, down in a procedure,
What
it's
I,
gonna
yeah, what I
take
do is
time.
I'll adjust and then,
Have them stand.
have them stand up. I didn't know this was being recorded. Nobody's gonna understand a thing I'm saying. You'll edit this out.
It's okay.
But no, then we'll have them stand up and check, but then they have to lay down again so we can adjust, because
Correct.
we don't want to be working on them like this.
Correct. And here's the thing, though. There is actually a positioning in dentistry where there is a standing dentist, and they'll actually keep you up, and you are positioning the patient rather than the dentist. So many dentists, when we meet, they've wrestled for so many years in this position that when they try to look over their shoulder, you know, there's this dentist. And we see this so frequently. In fact, that's one other thing we'll be teaching for our dentists this year, ergonomics. But when we look at this, then very simply, reprogram your jaw. Just let it go forward, open, and close, okay? This is key for your little kids that take the spills on their bike and have their lip go through, or their teeth go through their lip, okay? We've all had that. Little guy goes over the big wheel out into the road, crashes that, and now you start to hear this click or pop in his jaw, okay? He needs to reprogram. So have him do that every night for about 10 days, because that's a really hardwired program. He's taken a hard enough hit, he's going to end up with TMJ dysfunction later on. Usually little kids should not have popping jaws. Okay? Let me say that again. Little kids should not have popping jaw. Their jaw should sound as fluid and smooth as their knee bending, as smooth as their elbow bending. When they have popping jaws, they've taken a pretty big blow to the face. Okay? And that's where then this gets pushed back, and consequently then this disc is in here. It actually will be pushed forward and it'll heap up right here. And then when they open, it gets pushed forward, and then all of a sudden this jaw will pop over that disc in this position, and that's when it gets stuck open. Okay? And that's that locked jaw position. Now what happens over time is this disc gets worn out, and the worst surgeries that I've seen are the ones where they try to go in and cut this off and then try to recreate that joint. It's really tough, because proprioceptively, or nerve impulses going to the brain, in this jaw joint there is, remember in math, only one person will remember this. There'll be few. Summation. Okay. The sum of all joint mechanoreceptors in the entire body, if we were to look at the shoulders, the elbows, the hands, the legs, the spine, all the joint mechanoreceptors summated does not equal to the number of joint mechanoreceptors in the jaw alone. Okay? This joint can exude 2,000 pounds of force, okay, with the masseters and crushing, and yet can still detect a hair in my jello, right? Okay. But that's how sensitive it is. It's an amazing joint. And when it's off, the whole body is off, okay? The next, though, small jaw, the hyoid, right up under here is the hyoid bone, okay? It is even more sensitive than is the temporomandibular joint, because it actually acts as the guy wire, the sling, to move in that little rotational movement of mastication and chewing. Okay? Pretty phenomenal. And when this is off, then the jaw is completely off. So we really have to look at the hyoid as well. Okay? Wow. So, lots of info. TMJ, TMI, too much information. Let's go somewhere else. So we talk about children first because very commonly children will have a degree of dyspnea, difficulty breathing, due to these presentations, and we don't realize that that's what they're dealing with. Okay, little guy that's coughing all night. Let's get a new person up here. Thank you for volunteering tonight. Find a new volunteer. So with the child, then let's be aware of their breathing and their obstructed breathing. Now, observe also how many little children we see that are gaining weight. Okay, that are little guys like this, first and second grade that are approaching 100 pounds. That's not a very healthy scenario. So let's look again and see what we can see with respect to what's happening in the airway. Again, as here's my tongue. Now let's actually imagine that this person is lying down. So gravity's actually this way, right? So gravity's going to be coming from here. They're lying on their back, and this person is trying to get some rest, but just as wide-eyed as ever because they're not able to breathe. So we've already talked about then one condition where this nasal area becomes obstructed with the adenoids. So the tonsils and adenoids are removed. Another very common condition that causes respiratory airway obstruction are polyps. Okay?